Welcome to our Pediatric Nurse Mock Interview Guide. Whether you're just starting out or looking to advance your career, preparing for an interview can be daunting. But don't worry, we're here to help you shine. Let's dive right into our first question, focusing on adaptability, which is key in handling the dynamic situations you'll encounter with young patients. Can you share a time when you had to quickly adjust to a sudden change in a child's condition? This question helps the interviewer gauge your ability to think on your feet and react to unexpected changes in a clinical setting. Here are some pointers on how to approach this question. Pick a specific instance involving a child patient. Describe the patient's initial condition and what changed. Outline the steps you took in response to these changes. Mention any teamwork involved in the process. Wrap up with the outcome and what the experience taught you. Let's take a look at an example answer to bring it all together.
In the pediatric ward, I had a young patient with asthma whose condition suddenly worsened with severe wheezing. I quickly assessed the situation, administered an albuterol nebulizer treatment, and informed the physician. Coordinating with a respiratory therapist, we closely monitored her. Her condition soon stabilized, and I learned the critical importance of quick actions and teamwork in emergencies.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Pediatric Nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time you successfully explained complex medical information to a child's family. This question is designed to assess your communication skills, especially how well you can make complex information understandable to worried families. Here's how to effectively approach your response. Start by clearly outlining the situation or condition in simple terms. Use analogies or relatable examples to clarify difficult concepts. Encourage questions to ensure understanding and address confusion. Summarize the key points to reinforce the information. Provide written materials or resources for the family to take home. Here's an example of how you might answer this.
When explaining a child's asthma, I compared it to a garden hose that can get clogged, making breathing difficult. I encouraged questions and provided a handout summarizing key points. This approach ensured the family left feeling informed and supported.
Can you describe a particularly stressful situation you encountered as a nurse and how you handled it? This question aims to evaluate how you manage stress and pressure while ensuring quality patient care. Here are some strategies for crafting your answer. Choose a specific scenario that highlights your critical thinking. Explain the stress involved and its impact on patient care. Detail the actions you took to manage the situation effectively. Emphasize any teamwork or communication skills you utilize. Conclude with what you learned from the experience. Here's an example to illustrate how to structure your response.
During a flu outbreak on the pediatric unit, we experienced a patient surge. As the charge nurse, I coordinated with the team to prioritize care, delegated tasks, and maintained clear communication. This taught me the importance of staying calm and organized under pressure.
Imagine you have several patients needing attention at once. How do you decide who to attend to first? The goal of this question is to assess your resource management skills and ability to prioritize patient care effectively. Here are some tips to help you answer this question. Evaluate the severity of each patient's condition. Use the ABCs, airway, breathing, circulation, to prioritize. Communicate with your team to delegate tasks as needed. Keep track of patient needs with an organized checklist. Rely on your clinical judgment and experience to make decisions. Let's look at a sample answer to demonstrate this approach.
When multiple patients need attention, I assess their conditions quickly. If one child struggles to breathe while another has a mild fever, I prioritize the one with respiratory distress. I also coordinate with colleagues to ensure all patients receive the care they need.
How would you go about educating a child and their family on managing a chronic condition? This question evaluates your ability to educate and empower families to manage chronic conditions effectively. Consider these strategies when crafting your response. Assess the child's developmental stage to tailor the education. Use simple, clear language and visual aids to explain concepts. Involve the family in discussions and encourage their questions. Provide practical demonstrations like medication usage. Suggest regular follow-ups to reinforce learning and fine-tune the approach. Here's an example to illustrate how you might answer this question.
First, I evaluate the child's age and understanding to customize the information. Using visual aids and simple language, I explain the condition, involve the family by addressing their concerns, and demonstrate managing the condition. Ensuring they feel confident and informed is my top priority.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.